Good evening. Welcome to Hulsebus Chiropractic, Facebook, YouTube, live webinars. So we come at you live every month here with a new webinar where we discuss different things about chiropractic and how chiropractic may or may not be able to help you in different roles that we can do here at our clinic. And so we are live. We are coming at you right now. So if you are watching us on YouTube or Facebook, at any time you want to, you can leave a comment. We will see those comments and I will try to do my best to answer those the best I can. So if you come here every month, you'll see that we have our new little video studio here that we're in tonight. It's a little room down the basement of our clinic, and I came at you live tonight to kind of share it with you. Now, these live videos stay up. They're available to you after the fact. So if you hear something tonight that you think is interesting and you want to share it with somebody who you think might benefit from it, feel free to go ahead and share this along the way. We'll put it on our website. Under our website, we have an area there called blogs. And on the blogs, you can just click on it, you'll find it right there for you. We do it by month. We try to categorize them pretty good. But welcome to tonight's live webinar. Tonight, we're talking about chiropractic and headaches. This is a common thing that we see a lot of people come in the clinic with headaches. It's probably one of the most common things that we see. Maybe not so much a new patient. Like we don't get a lot of new people that come in off the street say, I have headaches, but a lot of our patients that we already take care of will come in because they didn't think about chiropractic first when it came to headaches. They thought about chiropractic first when it came to neck pain or lower back pain. But when they came in with their neck pain and lower back pain, they noticed their headaches went away. It's one of the most common things we hear, hey, ever since I've been getting adjusted, I noticed I haven't had any more headaches. That's awesome. And that's what we hear a lot. So a lot of people have to become a chiropractic patient before they discover how we help with headaches. Tonight, my goal is hopefully to help you understand how we help with headaches before you need us, or before you have a headache or even suffering. I don't want you to have that back pain in order to discover that chiropractic help with headaches. So tonight, the goal is to go over some research. I'm going to play some research here for you in a second. We'll review the research, and I'll talk a little bit how we use that in a clinical setting so you can educate yourself a little bit more about chiropractic before maybe you decide to come to a chiropractor. Now, the one thing I will ask you to do, if you continue to research chiropractic online, one of my favorite ways to do any kind of research is to type in the subject and type in the word PubMed, all one word, P-U-B-M-E-D, one word. That's one of the best places to do medical research of any type on the internet to find the most honest answers. And also, if you have any more questions about chiropractic, I always recommend you go to Palmer College, palmer.edu. You can find out lots of good information there. That's where I went to school, and it's my favorite chiropractic school. I got a banner right over here about it. And then other places as well as the chiropractic.org, it's the International Chiropractic Association. I don't recommend going to other websites to learn more about chiropractic because most of them don't know much about chiropractic. No more than you should go to chiropractic.org and look for questions about dentistry, right? You should stick with what you know. So if you want to know more about chiropractic headaches, reach out to us. We're here to help you. But let's get started talking a little bit more about headaches tonight. So let's get started right here with our little video about the research on headaches.
Do you suffer from headaches, or do you know someone who does? If you do, know that you are not alone. The head is actually the most common site of pain in the body. Headaches can range from mild head ache, pain, or tension that comes and goes, through to constant, intense, throbbing pain so bad you have to crawl into bed with all the curtains pulled and a bucket by your side to throw up in. Some people find it difficult to describe their headache or their head pain. However, others commonly describe their pain as throbbing, squeezing, constant, unrelenting, or intermittent. The pain may be in one part of your face or skull, or it may be generalized, involving the whole head. Headaches may arise seemingly out of the blue, or they may be associated with particular types of activity, such as computer use or during or after exercise. A headache may start abruptly, or it may come on gradually over time. It may reoccur time and time again, exactly the same, or it may get worse and worse each time you have one. A headache is often associated with nausea and vomiting. This is especially true with migraine headaches. Headaches, like any pain in the body, is a sign that something is not quite right. Your brain will create for you the sensation of pain if it thinks there's something wrong, or if it thinks there's a potential problem. For example, your brain will give you a headache if you have taken too much medication, letting you know that there is some chemical toxicity going on. And some headaches are a warning of life-threatening illness. Such headaches are usually associated with fever, a stiff neck, muscle weakness, or changes in sensation on one side of the body, changes in vision, vomiting, or change in behavior. But for most people, headaches are not a sign of life-threatening illness and are more the consequence of lifestyle and daily behavior. We know now from a lot of neuroscience research studies that when your spine is not moving properly, this changes the way your brain perceives what's going on in and around your body, the way it integrates all sensory information, and the way it controls your body. The movement of your spine is, in other words, very important for your brain to know where you are in space. And since you cannot see your spine with your eyes, your brain relies on the information it receives from the small muscles closest to your spine and skull. If the segments of your spine are not moving properly, what chiropractors call being subluxated, this may for some people manifest as headaches. Others may experience back pain, and some babies may experience colic, and for some kids, they may not be fully aware of their bladder at night and may end up with bedwetting. And I could go on and on and on. Research has also shown that when a chiropractor then gently adjusts these subluxations, those spinal segments that aren't moving properly, it helps the brain to more accurately see what is going on in and around the body. This helps your brain to accurately feel or see what is really happening in your body so it can properly control and regulate what is going on. It doesn't have to guess or make stuff up anymore about what movements you should be making, what your autonomic system should be doing, and what symptoms you should or shouldn't be feeling. Remember, pain is something your brain creates for you if your brain thinks there's a threat of tissue damage, or even just if there is a potential threat of tissue damage. So when you get adjusted by your chiropractor, if your spinal dysfunction was manifesting as headaches, these may improve. If your spinal dysfunction was manifesting as back pain, then this may get better. Or if it was manifesting as colic or bedwetting, then these symptoms could improve as well, and so on and so on. So let's look at what the research shows us about chiropractic care and headaches. Researchers have reviewed all the randomized control trials that have looked at the effects of chiropractic care or spinal manipulative therapy on headaches. In these studies, they have compared chiropractic care to sham care or other interventions, and the results show that chiropractic care does help some people with headaches and migraines. In one study conducted in Australia and published in 2000, the researchers looked at 127 people suffering with migraines. The researchers looked at the effects of 2 months of chiropractic care compared to 2 months of no chiropractic care and recorded the participants' migraine frequency, duration, disability, and medication use. After 2 months, they found that the chiropractic group got better compared to the control group, with all their migraine outcomes that they looked at. They found that for about 1 in 5 people, their migraine almost went away completely after 2 months of chiropractic care. And for half of the study participants, their migraine frequency significantly reduced. The results of this study suggest that a large number of migraine sufferers respond really well to chiropractic care. We don't know for sure who will respond well, and we don't know how much of an influence the placebo effect has. But for some people, when they get under chiropractic care, their migraines almost completely resolve within just a couple of months. Looking at another study, published in 2010, 80 patients with chronic cervicogenic headaches received 8 weeks of chiropractic care. Another group of 80 patients with chronic cervicogenic headaches received 8 weeks of light massage. The researchers compared the patients' pain scales relating to the headaches and their neck pain, and also the frequency of headaches and their medication use. They also looked at whether it made a difference seeing a patient once or twice a week, and they followed them up over a 24-week period. What they found was that patients receiving chiropractic care improved significantly compared to the control group that was receiving massage. Pretty much all of the pain and disability scores were better in the chiropractic group. And for some of these pain scores, the improvements lasted the full 24 weeks. The chiropractic group also had fewer headaches and took less medication by the end of the follow-up period. There appeared to be a small beneficial effect from being seen more often, but the results of this study weren't conclusive when it comes to frequency of care. The chiropractic group in this study were over 3 times more likely to have a significant improvement in their headache symptoms compared to people receiving light massage. So for some people, if their spines are not functioning well, it can cause headaches or migraines. But for others who have spinal dysfunction, what chiropractors call subluxations, it may cause back pain or neck pain. And for others, it may cause clumsiness or reduced sports performance, or changes in your mood, or completely other symptoms, such as colic, bedwetting, or high blood pressure. The thing is, we don't yet know exactly how subluxations are going to affect you. We need to do a lot more research to figure this out. But in the meanwhile, why don't you consider chiropractic care? Make sure your spine is functioning well so you can operate at your best.
All right, so that's our friend Dr. Heidi Havoc at the Research Center in New Zealand. She does lots of chiropractic research, and I like to share her work and kind of discuss it afterwards. So they talked about lots of different patients got different results. They're going to the chiropractor. I want to talk about in the clinical setting now. You come to our office. What do we look at to see if we can help you with your headaches? Well, headaches come from many different spots and many different causes. So our first initial examination is we will perform chiropractic x-rays where we evaluate your posture and your spine. And the very first spot we look at, I'm going to start from the top and work my way down. The very first spot we look at is the very, very top part of your neck, your C1 and your occiput. Your occiput's the base of your skull right back here. A lot of times when people have headaches and migraines, they'll talk about a lot of muscle tension and pain right at the bottom of their skull. Sometimes people describe it like a wrapper coming over their head, pulling on everything. And what that is in the base of your skull, there's muscles that attach right there called your suboccipital muscles. And what those muscles are, those are the most highly innervated muscles of your entire body. Those muscles have 273 muscle spindles per square millimeter. What does that mean? Well, you know, the next closest is 70 something in your TMJ joint. So these muscles, their job is to keep your head up at all times. So she showed a picture of some of the spinal muscles. So if you've got a misalignment in there, you got a rotation going on up there. The whole body will turn and twist to try to keep your eyes level. And that puts a tremendous amount of stress on these muscles. There's a lot of blood vessels and also your cerebellum right in that area. So these muscles get really angry. That's what happens. So a lot of times you come in here, I might say, I just did your head instead of your neck today. What we're doing there is we're freeing up that joint to get that pressure off those muscles. And a lot of times after the adjustment, we'll get up and be a little lightheaded for about 2 or 3 seconds. That's really common. But I always say if you're lightheaded after an adjustment, that's a headache we probably just got rid of. So right below that one, that's your first cervical, your C1, otherwise known as Atlas. Now it's called the Atlas because it holds the head up. Like in the old Greek mythology, Atlas carried the globe around the sun, or the sun around, I don't know. But Atlas, that was his job, was to carry the earth. Now, when the Atlas can rotate, it can rotate to the left or to the right, and it tends to like slide back and forth like this. It can also rotate up and back a little bit. And right when you're in the base of your skull, right back here is your midbrain. Part of your midbrain is your cerebellum. What happens is your nerves come up your spinal cord. They go to your cerebellum and your cerebellum to your brain, or from your brain to your cerebellum down. So some of us, our cerebellums hang lower than others, mostly because of neck posture and stuff like that. So if neck posture is an issue for you and your first cervical is rotated, it'll actually put pressure on that cerebellum. And that'll cause a lot of jam signals coming up and back from your brain. So we'll adjust that C1 a lot of times and we'll get great results for migraine headaches. The second spot we look at is the second cervical, actually, the next one down. This one's called the axis. The axis has a little thing that sticks up and the Atlas sticks around it and it rotates like this. But the thing about the Atlas is back to the occiput again. You know, when I go to the high schools and I teach the kids, I tell them the bigger the bump on the bone, the more muscles go there. And your C2 has a really big bump. You can actually feel it if you go to the back of your hairline. It's that very first bump right there at the bottom of your hairline. And there's lots of muscles that go there and then down to your shoulders. A lot of times we talked about this one back, we talked about neck pain because the muscles come up to your skull and down through your shoulder blades. So when this one rotates and gets problems, it creates a lot of havoc. Now the nerves that come out of this innervate your eyes, your nose, your senses, your sinuses and stuff like that. And also can have a lot to do with the shape and the diameter of your station too when it comes to ear infections and draining the ears. And we've all had sinus problems that result in headaches. So if you get a rotated C2, we always take a really close look at that one and to see how we can help that one. Now going straight down, I promise I'm not going to do every vertebrae. We're going right down from C1 to C2. The next one's our third cervical. And the third cervical has these branches that come out, probably the trigeminal nerve. It communicates with that. How does it communicate with that? Well, it communicates with that through what they call the trigeminal cervical nucleus. And what the trigeminal cervical nucleus is a little part of your brain. And what's interesting about the trigeminal cervical nucleus is whenever you have a headache, no matter why you have a headache, almost always, with very few exceptions, the trigeminal cervical the trigeminal cervical nucleus is involved. So we've studied this trigeminal cervical nucleus, all the nerve innervations in and out of it. And a lot of the times it innervates your face. That's when your sinuses get bad, back to C2 again, or if you have an impacted tooth, it'll talk back to the trigeminal nerve. If you have fluid in your ears, it goes back and forth. So a lot of times when the C3 becomes a problem, we see a lot of not only like facial stuff, but we also see some pretty bad headaches. So we take your x-rays, that x-ray we take, we have you open your mouth real big, and everybody feels foolish doing it. That's what we're looking at. We're looking at your occiput, we're looking at your C1, your C2, and your C3. And I mean, those are just the top 3 bones that are that important. So like I said, I'm not gonna do every bone. Actually, what I'm gonna do now is I'm gonna jump down to C5 and C6. So let's write down here a little further. Now, what's interesting about C5, C6, is a very important spot in your spine. This is the whiplash bones. So whenever you're involved in a whiplash, these bones take most of the brunt of the force. Now, the most mobile is C1, C2, followed by C5, C6. So whenever you have a whiplash or you can't turn your neck, a lot of times we see C5 and 6 involved. Now, what's so important when it comes to headaches? Well, your brain itself does not feel pain. You can't feel pain in your brain. So if you ever watch Discovery Channel and they're doing like a surgery on somebody, that brain surgery, they'll be awake and talking. I just watched one the other day of a guy playing the violin while he was having brain surgery, because you would never feel the scalpel go through your brain. And those of us who can remember this, they used to do a lot of lobotomies right up through your nose and cut your brain, and you wouldn't feel the knife go through your brain. But you do feel the pressure around your brain, and your blood vessels definitely feel the pressure around your brain. So what's interesting about C5, C6 is there's an artery that enters the neck at C5, C6 called the vertebral artery. And these 2 arteries travel up your spinal, next to your spinal cord, and they innervate the base of your brain, what they call the circle of Willis. And that supplies a lot of the blood to your brain. If there's a problem with C5, C6, a lot of times the artery itself can be compromised, or the stress coming from these spots can cause that artery to constrict and reduce the amount of blood going up to the base of your brain. This can result in serious headaches too. So when we look at your x-rays, we always start off with the cervical x-ray, the neck x-ray. We look at the first 3 bones for how they influence the trigeminal cervical nucleus, how they interfere with the base of the skull, how they deal with the muscles on the back of your skull, how they deal with the cerebellum, the switchboard of the brain, and how they influence those areas. That's the most common spots we see. So if you have headaches, we usually take a neck x-ray of you, and we see if any of these areas are involved. Now, there's one other area that's interesting when it comes to headaches that I've discovered, and that's your tailbone, your sacrum, that you sit on. Not the very, very tip called the coccyx, but the big sacrum, the big S1 through S5. Now, what happens is we are animals that walk on 2 legs. And when we walk, our sacrum goes back and forth, back and forth. Now, why does it do that? It does that because it's pumping the spinal fluid up and down, up and down. If you don't get enough spinal fluid around your brain can get dry and cause really, really, really bad headaches. Sometimes you might experience this. For those of you women who gave birth and had epidural, or anybody's ever had a spinal tap, you can leak spinal fluid. And when you're leaking spinal fluid, you get some wicked, wicked bad headaches. Sorry, that's the wicked's in Massachusetts in me. I used to live out east, but you get these really bad, wicked headaches. And so the only way to make them go away, they found, is if you lay down flat. Now, why does that happen? Well, if you lay down flat, the spinal fluid now can just come right down the spinal cord to the brain. But the moment you get up, wham, migraine headache. Now, a lot of times, some people say they feel better when they're walking around. That's because they get a little motion in the sacrum. So as chiropractors, we'll also take a look at your sacrum and see if that's fixated. Now, again, this is the easy one most of the time to figure out, because if you get a really, really bad migraine, you lay down, and within seconds, the migraine's gone. You stand up, and within seconds, the migraine's back. We pretty much know it's a spinal fluid problem. So we can adjust your tailbone and your sacrum in order to correct that as well. Now, earlier in the video, Dr. Hadman talked about frequency. She said that some people came in, the frequency was hard to determine whether or not it affected the headaches better or not. And I know a lot of you never been to a chiropractor or scared you're gonna have to come over and over and over again. But I want to talk about the frequency thing. How do we determine frequency? Well, we determine frequency based on how well you can hold your adjustment. If the first time you come in and we adjust you come back the next day and it's like everything's holding great, there's very little to adjust, you probably don't need to come a lot. If you come in the next time and we go to adjust you and like we didn't do anything, then we're probably gonna have to see you more. And the reason this happens is the amount of chemical, physical, and emotional stress you carry and how long you've carried it. So I told you I'd play a little video about some research. She briefly talked about the frequency, and I know it's always kind of a thing, like, if I come in, I get asked this question, people call on the phone, hey, I have a headache. How many times do I have to come to get rid of my headache? And I wish I was good enough to diagnose that over the phone. I really do. But the answer is we have to really look at you and see how you respond. What we do at our clinic is we custom tailor your schedule to you. So if you have a friend that comes in and sees us and they get care from us and they said, hey, I only had to go 4 times and I got better. You come to see me and I tell you I might need to see you for 3 weeks to get you better. It's basically you're 2 different people and you carry around different stress. I mean, if you've had a lot of whiplashes and your C5, C6 is you never come to the chiropractor after your whiplash and your C5, C6 is not corrected and there's arthritis degeneration there, it's going to take longer. And if you come in and your spine's healthy, you have good posture, it's going to take less time. So we really have to take an overall look at you and kind of come up that plan with yourself. So I talked a little bit about that. She finished a little bit with migraines, and I want to play another quick video about migraines, and then we'll wrap it up here.
Do you suffer from migraines? If you do, you will know how debilitating they can be. If you don't, just imagine suffering with a throbbing headache for days on end, and feeling nauseous and vomiting, and unable to stand bright lights and loud noises. Migraines really are awful. For about 1 in 6 people around the world, they experience this on a regular basis, often many times each month. Migraines are often severe and are considered by the World Health Organization to be the most debilitating of all neurological disorders. Trying to carry on a normal life when you suffer from migraines can be really challenging. Caring for yourself, let alone a family, can be tough, and trying to work when all you want to do is hide in a dark, quiet room can be all but impossible. A sad fact is that almost half of migraine sufferers don't get the relief they need from the usual drug treatment options. And to make matters worse, commonly prescribed medication for migraines can actually end up causing more headaches and more pain in the long run. This is a real problem. That is why researchers and health professionals have been exploring what other healthcare options may help people who suffer from migraines. One of these options that has received quite a lot of research attention is chiropractic care. This may be because so many people with migraines see a chiropractor for help. Let's take a look at what the research says about chiropractic care and migraines. In 2019, a systematic review was published that looked at all the clinical trials that investigated whether chiropractic care can help people with migraines. What they found was that when all the researchers combined, the people who saw a chiropractor or another healthcare professional who provided spinal manipulation, they had fewer days with migraines each month, and they experienced less migraine pain. That means that chiropractic care really does seem to help some people who suffer from migraines. In one of the studies they were looking at, the researchers found that about 1 in 5 people who suffered migraines, their migraines almost went away completely after 2 months of chiropractic care. We don't know for sure who will respond well to chiropractic care, and we don't know yet how much of an influence the placebo effect might have. But for some people, when they get under chiropractic care, their migraines almost completely resolve within just a couple of months. So if you suffer from migraines, or you know someone who does, consider chiropractic care, because it may really make a big difference to you or to the people you care about. Migraines don't have to be a life sentence, so go and see a chiropractor and rediscover what life is supposed to be like.
All right, we're back. So what I got out of that video, what I understand when she talks about looking at the research about whether or not cavities help with migraines, is that we found out that migraines are a hard thing to study. They come from so many different places, so many different influences. One thing I have yet to talk about is hormonal. We have a lot of women that get hormonal, really bad migraines. We tend to see them the week before their cycle, and they all report that, most of them all report that their headaches and their migraines are better, and also their cramping and stuff like that also gets better. But there's so many different reasons people get migraines. There's so many different reasons they come from. And the good news is when you're under chiropractic care for your migraines, usually the relief is fast. Usually we know right away. Usually you get adjustment, you'll wake, come off the table, and you feel tremendously better. It's I come in the room all the time and I'll see a patient laying there with the lights off or wearing sunglasses, and I know what's going on. They have a really, really bad migraine. They might be even holding the bucket. We'll lay them on the table. We'll get an adjustment on them, and they'll walk out with the lights on and the sunglasses off. I mean, it's fast. So if you know somebody has migraines, if you suffer from migraines or really bad headaches or any type of headache at all, and you've been struggling for an answer, I would tell you to come in and try chiropractic. We might not have the answer to every one of them, but we seem to do really good with most. So come on in and give us a try. Like I said, we're going to take your x-rays. We're going to look at those spots I talked about. If you want to come in, tell us you watch this video. We'll sit down with you and we'll figure out what we can do with your insurance and how to make it affordable for you. That's what we do here. That's why we've been open since 1949. But we'd love to get the opportunity to see maybe we can get rid of those headaches for you. Come back here. I'm doing this every month. I do a webinar every month. I do it on the first Tuesday of every month, different topics every month. And then what we do is for the rest of the month, every Friday, we have this thing called Friday Favorites. It's our chiropractor's favorite thing. So we try to stay on par with the theme of the month being headaches. So come back this month. There'll be more videos of stuff that we like to do when we talk about headaches and things that we treat headaches with, maybe like things we do for dehydration and stuff like that. Then every Monday we have Ask the Chiropractor, where a patient asks us a question or someone submit a question online to us, and we go and answer that question for you. So if you have a question, reach out to us, contact us on my website, call us, email us, send us, well, there's so many different ways to talk to us today. Just send us a message, ask us your question, we'll get back to you. I hope you got a little something out of this information. If you want to know more, come and talk to us. Our doors are always open. And other than that, thank you, everybody. Have a fantastic night, and we'll talk to you again here real soon. Hope to see you here Friday afternoon or Monday mornings or even next month. All right, thank you.